Heart attack, also known as a myocardial infarction, or MI, is the death of heart muscle cells due to the lack of blood flow, most commonly caused by atherosclerosis of the coronary arteries. The most common symptoms of myocardial infarctions include crushing chest pain or pressure that might radiate up to the left arm or jaw, sweating, nausea, and dyspnea. Treatment of myocardial infarction includes reestablishing blood flow using medications, angioplasty, or percutaneous coronary intervention. But underlying risk factors should be addressed for long-term management.
According to the World Health Organization, cardiovascular disease is the leading cause of death worldwide, as well as in the US. Of those, a large proportion are caused by heart attacks, also known as acute myocardial infarctions or just myocardial infarctions, sometimes just called MIs. The word infarction means that some area of tissue has died due to a lack of blood flow, and therefore a lack of oxygen. Myo refers to the muscle, and cardial refers to the heart tissue. So with a heart attack, or MI, you have death of heart muscle cells because of a lack in blood flow, a process called necrosis. Now the heart's main job is to pump blood to your body's tissues, right? Well, the heart also needs blood, and so it also pumps blood to itself, using the coronary circulation. The coronary circulation is the system of small arteries and veins that help keep the heart cells supplied with fresh oxygen. Heart attacks happen when these small arteries become blocked and stop supplying blood to the heart tissue. And if this happens for long enough, heart tissue dies. Almost all heart attacks are ultimately a result of endothelial cell dysfunction, which relates to anything that irritates or inflames the slippery inner lining of the artery, the tunica intima. One classic irritant are the toxins found in tobacco, which float around in the blood and damage these cells. That damage then becomes a site for atherosclerosis, a type of coronary artery disease where deposits of fat, cholesterol, proteins, calcium, and white blood cells build up and start to block blood flow to the heart tissue. This mound of stuff has two parts to it: the soft, cheesy textured interior, and the hard outer shell, which is called the fibrous cap. Collectively, this whole thing's ominously called plaque. Usually, though, it takes years for plaque to build up, and this slow blockage only partially blocks the coronary arteries. And so, even though less blood makes it to the heart tissue, there's still blood. Heart attacks happen when there's a sudden, complete blockage or occlusion of a coronary artery. So let's see how that can happen. Since these plaques sit right in the lumen of the blood vessel, they're constantly being stressed by mechanical forces from blood flow. And interestingly, it's often the smaller plaques with softer caps rather than the larger ones with harder caps that are especially prone to break or get ripped off. Once that happens, the inner cheesy filling, which remember is this mix of fat, cholesterol, proteins, calcium, and white blood cells, is thrombogenic. And this means that it tends to form clots very quickly. So platelets, or blood clotting components in the blood, flow by and get excited, and they adhere to this exposed cheesy material. In addition to piling up, the platelets also release chemicals that enhance the clotting process. Now this happens super fast. Think about how quickly a small cut stops bleeding. That's a very similar process. It happens in a matter of minutes, right? And now that coronary artery is fully occluded. So now let's change views a bit. If we take a slice of the heart like this side being posterior, or the back, and this being anterior, or the front, with the left and the right ventricles here, and then we have the three most commonly blocked arteries, the left anterior descending, or LAD, which supplies blood to the anterior wall and septum of the left ventricle, which accounts for about 40 to 50% of cases, the right coronary artery, or the RCA, which covers the posterior wall, septum, and papillary muscles of the left ventricle, accounts for about 30 to 40% of cases, And finally, percutaneous coronary intervention might also be performed, where a tiny catheter is used to place a stent in the coronary artery to physically open up the blood vessel. Each of these focuses on re-establishing blood flow to the dying heart cells, since time is tissue. If early enough following blockage, some of these cells that haven't entered into the irreversible stage can be salvaged and saved, while the others will be destroyed and removed. This can improve both short-term and long-term function, as well as prevent further damage and reduce the overall zone of necrosis. Now, an important complication of re-establishing perfusion, or reperfusion therapy, is reperfusion injury, where tissue is damaged by returning blood flow. And this is thought to happen because of a couple mechanisms. First, blood flowing back to the cells brings this influx of calcium. And since calcium leads to muscle contraction, the irreversibly damaged cells contract. And since they've been irreversibly damaged, they get stuck like that and can't relax. This shows up on histology as this characteristic contraction band necrosis. Also though, blood brings along oxygen, right? Yeah, it does. But that oxygen, paradoxically, can actually lead to more cellular damage. The conditions in an ischemic heart seem to cause an increased conversion of the returning oxygen to reactive oxygen species, which can go on to damage more heart cells. In addition to re-establishing blood flow though, there are a number of medications that might be given in the acute setting, including antiplatelet medications like aspirin, anticoagulants like heparin, nitrates which relax the coronary arteries and help lower preload, beta blockers that slow down the heart rate and thereby cardiac demand, pain medication to help relieve discomfort, and statins which help improve a patient's lipid profile. Now there are a ton of individual factors to consider when it comes to acute management of a myocardial infarction, and of course many long-term issues to consider as well, the most important of which is to address the underlying risk factors like an improved diet and quitting smoking.